From media stories on celebrities to heartbreaking stories from our friends, chances are you know someone who is addicted to drugs or alcohol. Yet we often hear the words addiction and dependent used interchangeably. Are they the same? Today our guest is Ed O'Reilly of the Neil Kennedy Recovery Clinic in Dublin, and he's going to help us sort out the differences and how we might be able to help someone we love. Ed, nice to see you again.
Nice to see you, Gail.
Well, let's start with that difference. I know I've used them interchangeably. I thought they're the same thing.
Well, they are used interchangeably a fair amount, and to some extent the medical field and the addiction field's a little to blame for that, because the actual diagnosis you get is alcohol dependent, opiate dependent, okay? And what they're actually saying is you're addicted. It's just the field didn't want to use the word addiction because it's a little biased.
It's a little more harsh,
yes,
basically?
It is, exactly. But what happens is physical dependence is different. It just means your body has acclimated or gotten used to a particular medication being in it, and if you stop, suddenly you'll have withdrawal symptoms. You'll feel bad, you'll get sick, depending on what the medication is. Addiction actually doesn't mean dependence, really. What we're really talking about is negative behaviors that I engage in as a result of my drug use. Okay? I can get dependent on pain medication, but I'm not addicted unless I'm doctor shopping, okay? I'm stealing other people's medication, I'm committing felonies to get more medication. So what we're actually focused on is it's the negative behavior that's associated with the use rather than the physical dependence. The physical dependence, of course, factors in, but that's not the main issue.
Interesting. You see people in your clinic who come to you addicted, and part of sometimes getting them off whatever they are on is another type of drug, maybe.
Yes, that does.
And there's people that will really fight that. They go, I'm already addicted to this, and what are you going to do to me?
We do run into that. I will say the category of what drugs have you got for me is a little bit more prevalent because that's where they come from,
yeah.
Which is they got into a problem in the first place by thinking drugs were a solution to their life. But drugs can be helpful, particularly when we talk about the dependence issue and the fact that when you stop using, you'll have withdrawal. Opiate addicts in general call that getting sick. Okay, and they're very afraid of it. Okay, and some medication that's available can get rid of that and also suppress cravings to use. So it's helpful. In and of itself, it's not treatment. Okay, but when used together with treatment, it works very well. It's a little analogous to me to if I go to the doctor and I have high cholesterol, he might put me on Lipitor, but he will also say, you need to make lifestyle changes, you need to start exercising, you need to eat a little bit better. So it's the combination of the medication and the treatment that's helpful.
And this kind of takes away some of that physical, the part that's ugly for them to help them get through to that treatment.
Exactly, that is what it does.
Many people have to take, because they're in pain, they've had surgery or for whatever reason, but they're reluctant to take pain meds because they feel that this is going to lead to dependency, addiction. What do you say to those folks?
Well, to be honest, it might.
Yeah?
That's what I say. The data that's out there basically says if you're on opiate-based pain medication for about a year,
that's a long time.
That's a long time. Then you run a 10% to 20% of those people will become addicted. Not just dependent, but addicted, which means they're going to exhibit negative behaviors associated with the drug use, and they're going to keep it up anyway. Okay, 10 to 20%, and that's nothing to sneer at. That's kind of scary.
And yet doctors are giving out oxycodone, OxyContin for really severe pain. So what are the guidelines? Are there any? A certain amount of time and you should be done?
Well, doctors pay a lot more attention to that these days.
Which is good.
Okay, it is. And always talk with your doctor if you have concerns, clearly. But for shorter durations, which is what most people get it for, there generally isn't a problem. Okay, now it is a problem if you keep going to multiple different doctors for short durations. And then
you're seeking it out again, and that's where you know you start to have a problem.
That's a problem. But I guess the answer would be, if we use with caution, do take it. I mean, if the doctor says take it the way he says to take it. Okay. Don't take too much. Don't take too little and save the rest for later. Okay? Don't give it to your friends.
Yes. Lisa, this is all good advice, Ed. Thank you. And if people have any other questions about this, we've had your number and where
Yes.
they can get a hold of you too.
Yes.
Ed, thank you. Nice to talk
Thank
with
you, Gail.